So we talked in detail about the diseases of the external ear, in which we talk about the deformities of the external ear, different shapes of the external ear, and then we talked about the congenital tumors, benign tumors, and some malignant tumors of the external nose. So after the external nose, let's talk about some diseases of the nasal vestibule. In this, we will talk about furuncle or boil and vestibulitis. Boils are very common in the nasal vestibular area, especially in the hair follicle. So we will talk about that. And then we will talk about stenosis and atresia of the nares, and then some tumors of nasal vestibule. So first, the furuncle or boil, if you see in this region, a lot of people, when they pick on the hairs in the nasal vestibule region, they can form the boil or furuncle, and it's a very, very painful condition. It hurts a lot. So it's an acute infection of the hair follicle by Staphylococcus aureus. So Staphylococcus again is the causative agent for the boil or furuncle. And if you remember, we talked in the first slide also that cellulitis of the nose is also because of streptococci and staphylococci. So this again is the causative agent is Staphylococcus aureus. So this is the picture that tells the furuncle and boil. Trauma from picking of the nose or plucking the nasal vibrissae. So when nasal vibrissae are plucked or picking of the nose, this can lead to boil or furuncle. Inflammation may spread to the skin of nasal tip and dorsum, which become red and swollen. So here this can spread to tip and then other area and cause the swelling of the nose. Lesion is small but very painful and tender. So very painful condition is the furuncle or boil as a result of plucking of the or picking of the nose. Then vestibulitis is as the name shows, is the infection or inflammation of the nasal vestibule, is diffuse dermatitis. Dermatitis is infection of the skin of the vestibule, and this can lead to the abscess or pus formation in the nasal vestibule. Predisposing factors and that can lead to vestibulitis. We have nasal discharge due to rhinitis. If there is rhinitis or runny nose or inflammation of the nose, this can cause nasal discharge due to rhinitis, can lead to the vestibulitis. Sinusitis or inflammation or infection of the sinuses or any allergies can lead to vestibulitis. Coupled with trauma of handkerchief, in case of runny nose and allergies and sinusitis, too much use of napkins, handkerchief or tissues can lead to vestibulitis and inflammation of this. This is the picture of the abscess as a result of vestibulitis. Treatment is cleaning the nasal vestibule of all crust and scales with cotton applicator soaked in hydrogen peroxide and application of antibiotic steroid ointment. So as a result of that constant runny nose or infection and inflammation, there is deposition of crust and scales that should be removed with the cotton applicator, and then ointments that contain antibiotic and steroids should be applied on the area. It can be of acute form and acute vestibulitis. The skin is red, swollen and tender. Crust and scales cover an area of skin erosion or excoriation. And then in the chronic form, there is induration of skin with painful fissures and crusting. As a result of acute form, there are crust and scales present, but when it becomes chronic form, as a result of constant handling of the nose and the vestibule, there are fissure formations and there is crusting, and those fissures are painful and they can hurt really bad. So fissures are cracks in the skin. So as a result of constant handling, there is fissuring and crusting of the nasal vestibule. Then another condition of the vestibule is stenosis. Stenosis is the narrowing and atresia of nares. These are the nostrils or the nares. If you see in one picture, there is narrowing which can be due to stenosis, or an atresia of the nares can also be present. Here, web formation and stenosis of anterior nares that can cause obstruction or blockage. Accidental or surgical trauma to nasal tip or vestibule can lead to stenosis or atresia. Destructive inflammatory lesions can also lead to stenosis. Congenital atresia of anterior nares due to non-canalization of epithelial plaque. So all these are the different conditions that can cause stenosis and atrophy of the nares. This can be due to congenital atresia of anterior nares because of non-canalization, or opening is not formed in the during the development, and it can lead to congenital atresia. Patient will have problem in breathing, and all different types of complications can occur as a result of stenosis and atresia. Next, the tumors of vestibule. These are the pictures of some tumor which can be nasoalveolar cysts. They are smooth bulge in the lateral wall and floor of nasal vestibule. This is the lateral wall, and this is the lateral wall of the vestibule and floor of the vestibule. So nasoalveolar cyst are small bulge in the floor and nasal lateral wall. Then papilloma or wart. This is the picture of the wart or papilloma, which can be single or multiple, pedunculated or sessile. Pedunculated have a stalk with which they attach. Sessile have no stalk. These are the sessile papilloma or the wart. Squamous cell carcinoma, it arises from the lateral wall of the vestibule and extend into the nasal floor, columella and upper lip. So all this can occur in the lateral wall, but then it can spread to the tip, nasal floor, tip, columella and the lips. So all these are the different tumors that can affect the vestibule of the nose. We have nasoalveolar cyst, then we have papilloma or wart, and squamous cell carcinoma of the nasal vestibule. So that concluded our lecture of external nose and the vestibular disorders and deformities. Thank you for watching sqadia.com.